Well, being told you may have to lose your leg because of poor circulation can be heartbreaking, but there are ways to avoid amputation. It can often be prevented by restoring blood flow minimally invasively in an outpatient facility. And joining us now is Dr. Rick Bernstein from ACV Centers with how this is possible. And you look like you are busy, my friend, so we won't keep you too long, but talk about this. Is it true that many patients are referred for amputations with no vascular workup?
Well, unfortunately, that's the case in our area. There's an epidemic going on of patients who have non-healing wounds in their legs or pain at rest and even the development of gangrene in their toes from critical limb ischemia, meaning not enough blood flow getting to the legs. And unfortunately, in our area, 70 to 80% of those patients are being sent for amputation as their primary treatment without any vascular attempt to restore the blood flow, which we do non-surgically in our outpatient lab to save their legs.
Oh, that's a lifesaver for sure. So yeah, can amputations of the legs or feet be prevented by this non-surgical blood flow restoration that you're talking about and done outside hospitals?
Yes, often we can do that. And very safely outside of the hospital where patients don't have to deal with the COVID situation and other hospital related issues. And we can restore the blood flow, especially if we get the patients early enough before the arteries have been destroyed by the disease, which usually involves diabetes, high blood pressure, smoking, kidney disease, and high cholesterol. And we are able to restore the great majority of patients and save their legs, which is so important because once a person gets a major amputation, the chances of them being alive are only 50% 2 years later.
Oh, wow. And can these procedures be done by any doctor, or I'm assuming highly specialized training is needed?
Highly specialized training is needed. I'm, for example, a trained cardiovascular surgeon, and I went back recently to do an entire year fellowship with the two best endovascular specialists in the country, Dr. Mustafa and Dr. Saab at Michigan State University, to learn how to open the arteries, not just in the thigh, but below the knee and all the way onto the foot, because the blood supply has to be restored all the way down to the foot, or the rest really doesn't make much difference.
Well, I'm glad that this service is out there, Dr. Rick. We really appreciate it. We got the phone number on the screen along with the website. And yeah, get back to work. It looks like you have a busy day ahead.
Correct. And thank you so much for doing this. We hope that everyone understands that saving a leg saves a life.
Absolutely. All right. Thanks, Dr. Rick.